Hello, everyone, and welcome to tonight's virtual town hall series, Candid Conversation about COVID. Tonight's event is hosted by the City of Huntington Beach in partnership with Huntington Beach Hospital. The purpose of tonight's town hall is to share the latest updates about COVID-19 and the vaccines, so our residents can make the most informed decisions about vaccines for themselves and their loved ones. Tonight, we'll be reviewing the most current COVID statistics, answer some most frequently asked questions, about vaccines. Our main discussion topics will include COVID-19 updates, facts about the vaccines, mobile vaccine pods, and how do I get a vaccine, as well as a question and answer session at the end. I want to encourage our folks to visit HB Hospital's website, as well as the HB Ready website, which would be hbready.com/townhall and /vaccine. The town hall will include recordings and PowerPoints from tonight's town hall, as well as previous ones. And /vaccine obviously will have information that you'll find your nearest vaccine site and whether or not you are eligible now. And then lastly, we'll end tonight's session with a Q&A session. If you'd like to submit a question, please enter it in the comments box, and our staff will share them with tonight's panel towards the end of the town hall, and they'll do their best to answer your questions. Tonight's panelists will include myself. I'm Dan Kalmick, a newly elected city council member for the city of Huntington Beach. Dr. Rick Rowe, who's the CEO of Huntington Beach Hospital, and our own Scott Haberly, who is the Huntington Beach fire chief. Dr. Rowe and his organization have played an instrumental role in vaccinating some of our most at-risk residents, including the elderly and those working in higher fields such as our hotels. And Chief Haberly is an incredible team, have been working on this pandemic since day one and on so many fronts. Been excellent in getting COVID under control in our city, and his paramedics are actively responding to COVID calls for emergency services. And most recently, they've been working with Rick's folks to set up vaccination clinics in our community. And with that, I'd like Chief Haberly to kick off tonight's town hall with our latest updates on COVID-19.
Thank you, Councilmember Kalmick. If you go to the worldwide situational overview slide, and what you can see is it's incredible to look at how many people have been affected, how many deaths we've had worldwide by this virus. And if you watch the news recently, you know that in Europe and other parts of the world, we're still seeing a larger surge as their vaccination efforts haven't been as efficient as the United States. And so I think it's something to pay attention to, because we really want, as more vaccines move out on the market, as more countries and the vaccines are available in more countries, we're gonna have a much better and much more efficient chance of getting a hold of the virus. If you look at although the pandemic isn't over, if you look at the next slide, and there's a lot of good news in the US about what's going on in the US. And so in the US itself, we're starting to see this dramatic drop in COVID cases after the vaccine started to roll out through our first responders and hospital staffs sometime shortly after Christmas of last year. And so as you can see on the chart on the right-hand side, you can see how fast it's dropped off. But the area we want to bring your attention to is it has plateaued. And so anytime when you look at these charts and you see a plateau in the chart, you always want to make sure we're not anticipating another surge associated with that. And what's happened in the United States is we have about 31 states right now that are starting to see an increase in cases. And unfortunately, those cases are really in younger folks. We're still seeing the majority of those cases in under the age of 50, and we're still seeing the deaths in ages over 50. And that's really indicative to how we're rolling out the vaccines. That's why it's really important to continue to get the vaccines out, to make your appointments, and to move forward with that. And so we're doing definitely better in the United States than the rest of the world. If you look at California in general, we are in the orange tier, and the orange tier we moved into just recently. However, a couple of our metrics that we measure the tiers, we're actually in yellow, which is a great thing, and I think we're starting to see that move more and more throughout the United States. As we'll talk about and look in the next slide, you can see our overall metrics moving forward. You see the adjusted daily case rate is 3 per 100,000. It's really incredible to look at this, because back in November, right around Thanksgiving to Christmas, we were well over 100 per 100,000. It was significantly higher, and with the vaccine rollout, we've seen such an incredible drop. Now the positivity rate and the health equity are actually in the yellow right now. And so as more vaccines become available in the state, and as we start to reach the metrics set by the governor, the adjusted daily case rate of 3, putting us in orange, may drop to a lower number, which will allow us to move into yellow much more quickly. Overall, we're trending in the right direction. This is exciting news. It's a good thing for us, and we have to really, just because we're moving in the good direction, this is going to keep us. Make sure you're wearing your mask, social distancing, get your vaccine. We want to continue the progress. That's the only way we're going to keep people safe, keep people from getting sick, get our businesses open, and get back to our way of life. We just have to continue on this really positive direction that we're moving. If you saw the news yesterday, the governor announced that there's a really strong chance that we're going to move back to our daily activities, like with maybe not exactly like we remember it, but very close to how it used to be, starting as soon as June 15th, which is pretty remarkable to understand that. Although although COVID and the pandemic still has some time to go for us to reach that herd immunity, this is a really great sign for us and our people and our economy. So we're going to talk a little bit now and with Dr. Rowe about the vaccine and kind of where we are now with them. In the United States, we have really three options. And all the clinical trials really show that all three vaccines, that the option is shown to be 100% effective at preventing hospitalization and death from COVID-19. And it's truly remarkable. And we've seen that in anecdotal evidence just in our fire department and our city. When the vaccines roll out, just a dramatic drop and almost basically to zero in cases here. When you look at it, you have three options. And I think the biggest thing to remember, because people have asked us quite often, is which one do I get? Is there a better one than someone else? I think the bottom line is the best vaccine is the one that you can get right now. The one that you can sign up for and get in the process is what you want to look for. And I think that we have two that we've heard a lot about, which is Pfizer and Moderna. And that one, the efficacy rates are over 90%. You typically go with 2 doses for this one, and they're either 28 days or 21 days apart, depending on the dose. The Johnson & Johnson is rolling out. Although the rate's 66%, that's still tremendous. It's still 100% effective at preventing hospitalization and death. And it's a one-shot, and you're completed with that. And so a lot of people have asked the question, well, which shot am I going to get at what location? The bottom line is if you get your Athena appointment and you're moving forward, that's the right shot for you. If you go to vaccine supplies, they are ramping up, and I think Dr. Rowe was going to talk a little bit about this.
Yeah, the safety, the supply issues are being resolved, and we're getting the supplies in more and more over the last couple of months. It's still not where we need to see it, and we do feel very confident that we're going to be able to be running clinics much more often. We're not having significant delays in getting the vaccines, and I think that we'll have that process continuing as we go on. And
I definitely think that in Orange County, we're seeing this 32% increase of basically right now is the total population that has received the vaccine. That's remarkable. Really, nearly 17% of our population are fully vaccinated, and significantly with 77% over the age of 65. And if you'll recall, over 65 was where most people were seen in the hospital related to COVID. And also as a reminder, April 1st is open to 50 and over, and April 15th, it'll be open to 16 and over.
One other thing on the, I apologize, go ahead.
No, go ahead, sir.
On the 16 and over, on April 15th, the county yesterday okayed for 16 and over in certain equity zip codes. There's 4 of them in Orange County, and you go on the Orange County website to find out those.
And so a lot of the questions we get asked, are the vaccines safe? And so if we look at vaccine safety facts, the FDA vaccine safety approval process in the United States is a recognized, and it's really a preeminent system in the world. And there's been over 120,000 volunteers who participated in the Pfizer, Moderna, and J&J vaccine clinical trial studies. None of these studies of the trials reported any serious safety concerns. And all the vaccines had fully independent safety monitoring boards. The safety data was and continues to be reviewed by the FDA and their expert panels. And a little bit about how I can trust a vaccine and that was developed in record time. And Rick, I don't know if you have any thoughts on this.
Yeah, it's thank you, Scott. The vaccine actually testing process didn't skip any steps that we normally go through. Several testing stages. What was really remarkable about the program and the speed is they put several steps in line with each other. The government funding the vaccine preparation before it even started, committing to buying the vaccine. It's a incredible amount of money to develop a vaccine, especially a vaccine or any drug. And this sped up that process tremendously. So nothing was really skipped. Everything was running in tandem, 3 or 4 steps along the way. Pfizer Moderna created theirs using the mRNA technology, and that's been on the shelf and tested probably for 40 years. Just able to get the focus and to get this out was amazing before the pandemic. And just of note too, there's a lot of concern out there whether the mRNA vaccines alter your DNA. They do not touch your DNA. They cause the body to reproduce copies of the spike proteins on the surface of the COVID virus, and that allows your immune system to destroy it and then creates the antibodies. It's your body's producing mRNA and sending it into your cells constantly, telling it to produce different proteins. This is no different. It's just taking advantage of that remarkable technology. One of the people is, how can I trust continuing that in the record time? Social media allowed the firms to enroll over 73,000 volunteers more quickly. That's significantly more volunteers than usually are testing other drugs that are approved by the FDA. Because the COVID was so contagious, the volunteers quickly got exposed to the virus, which allowed those trials to proceed faster and resolve. And the companies began manufacturing certain portions of the vaccine, like I said earlier, ahead of their authorization, so the supplies would be ready when the approvals were granted. That was a significant factor in helping these companies spend the resources to develop it when the government provided that funding. Some of the side effects, most common side effects really tell you the vaccine is working. Some arm soreness, body aches, fatigue, low-grade fever, some chills. Usually those are a day or two and don't take much more than some mild pain relievers. Many of the stronger side effects occur after the second dose in many people, and that's actually a good thing. That means your body's producing a robust response to the vaccine and building up the antibodies to give you that protection. And everybody reacts differently. Some people have those chills and fever a couple days, and others, fortunately, had little effect from it. And again, most of those symptoms last 24, 48 hours and they resolve. And you're not infectious. You can't get COVID. You don't have COVID. It's just some mild vaccine side effects.
Yeah, and I remember that. So I had the shot, I had Moderna. The first shot I received, I had some arm pain, kind of localized arm pain for a couple of days. No real side effects. On the second shot, I had about 10 hours after the second shot, I had a little bit of a little low grade, kind of low grade fever, a little bit, just felt tired, take a nap maybe, that area. But that was about it. By the next day, all those symptoms were gone. They only lasted a very, very short time, probably for me about 30 or 40 minutes. But I definitely felt, one of the things we hear consistently from people that we talk to, our own staff and people that went through vaccination efforts, is they talk about there's a little bit of that tired feeling for that first 24 to 48 hours. And so that's been pretty common. For me, getting it was the tired, little bit of a low grade fever that night after about 10 hours and just arm pain. So. Some of the things that people talk about with vaccines, about the new variants, and I know this is something in the news, and we do get a lot of questions about this with our staff, and the vaccines appear to be effective against the variant found in Britain. There's a lot of discussion about how that affects the variants from South Africa and Brazil, whether it's like more or less effective, and I think they're still looking at that and how that looks for more of a long-term study. However, we are still seeing vaccinated people still appear to be protected against any serious illness. And they're going to continue to work and produce that evidence and that discussion moving forward. I think the reality is we maintain social distancing, we maintain the health protocols, and we still receive vaccinations. I don't think that's a reason or a way to wait or wait for a different vaccine to come out. This is the appropriate one, and this is the one that's working very well. And we get a lot of questions about young adults, and I know Rick has some thoughts on that.
Yeah, it's people, the young adults really need to get vaccinated. And, and I hear this from my, that was hearing it from my 20-somethings children. And the same thing, it's like, yes, you need to get vaccinated, even though you're probably not going to get very sick. It's a highly contagious disease. The variants, some of them are very contagious. And some are affecting the young more so than the elderly right now. And actually, some of these are getting ill and becoming hospitalized worldwide. Again, most young people are not likely to die. So trying to convince them to get the vaccine because they think it's not going to affect me very much. It's really the people they encounter. It's their parents and grandparents that maybe haven't been vaccinated for one reason or another. But it also helps us to get this herd immunity up that we need. And plus they can still transmit the disease to others. So we need them to contribute and do their part too.
Yeah, I think it's a great point. There's a lot of times when people talk about, well, I won't get as sick, or I won't die from it, or I won't get hospitalized because I'm younger, but there still is transmitting the disease. And the more people that transmit it, that relates to more variants. And so the idea is for getting them vaccinated so you're not accidentally transmitting this disease to your grandparents, to your parents, to someone in your house. And I think that's a great point Rick makes, is that oftentimes we use that, oh, well, it's just a cold for me because I'm younger. But it's really not you. It's how you're going to spread that and move that as a vector to someone else that we really want to be cautious about. I know we talk a lot about whether or not children or teens get the vaccine, and I think Rick, we were talking about this earlier before we talked tonight. Do you have some thoughts on that as well?
Well, all three of the manufacturers conducting trials for children and teens right now, depending on the positive outcome, and we expect a good positive outcome from these trials. We estimate that teens from 12 to 17 will be eligible for the vaccine in the fall, younger children by early 22. All three manufacturers are conducting trials. I think Moderna is doing 6 months to 17 years of age. And they're currently only authorized for 18. And then Pfizer and then Johnson & Johnson, which just released their vaccine, they're in various stages of the trials with children now. So looking for a few months, hopefully, to get one of these out for the younger group, because we need to get them vaccinated. Again, just like the young adults, they're transmitters of the virus, and will help us all to get that herd immunity we hear so much about. And some other things. Actually, one of the first questions I got after we started vaccinating some of our healthcare workers, I asked a nurse why she wasn't getting the vaccine, and she said, well, I heard it's going to cause infertility. That's not true. It does not cause infertility. There's no evidence to suggest that the vaccine causes infertility. It's interesting to note that during the vaccine trial for Pfizer, which included almost 44,000 people, women were given pregnancy tests to be accepted into the study, and those that were pregnant were excluded. However, during the trial, 23 women still conceived, and 12 of those pregnancies in the vaccine group and 11 in the placebo group. And there was no issues at all in the pregnancy group. So that is, it's a safe vaccine for during pregnancy and after. A recent study in the American Journal of Obstetrics and Gynecology states that Moderna and Pfizer vaccines are safe and effective for pregnant and breastfeeding women. It also shows that actually the vaccine may confer antibodies to the babies in utero and through breast milk. More research obviously is needed for all of this, but studies suggest that the vaccines do not cause any harm to the mother or baby. Especially pregnant women are at higher risk of severe COVID illness, and the vaccines may likely reduce that risk. So it's always something to speak with your obstetrician or pediatrician about, but it does look like they're going to be safe for that group. Some people say, well, who shouldn't get the vaccine? There are some who probably should not, or consult their doctor before they do. Some people with allergies to the polyethylene glycol or polysorbate used in these agents, stabilizers, should not get the vaccine. When you're getting other vaccines, there should be about a 14-day wait between the two vaccines. And also those folks that have been doing some advanced treatment protocols using convalescent plasma or the monoclonal antibodies should probably wait about 90 days before getting the COVID vaccine until more study is done. And then Scott, you were going to talk something about when people are fully vaccinated.
Yeah, so thank you. When people are fully vaccinated, we're looking at 2 weeks after your second dose of Pfizer or Moderna, excuse me, or 2 weeks after the one dose you get of Johnson & Johnson. And so that's when you have the full efficacy that they've talked about in the studies. And then what can I do after I'm fully vaccinated? And so the CDC does recommend that you can gather indoors with other fully vaccinated people without a mask. You can gather indoors with unvaccinated people from one other household without masks. But if you've been around a person with COVID, you do not need to get tests unless you develop symptoms. Where in the past, if somebody would call you and say, oh, we were, you went to dinner with somebody the day before and they call you the next day and say they have COVID, you would want to go out and get a test within those next 24 to 48 hours. And this is months ago, we would do this. Now, if you've been vaccinated, you don't need to get the test unless you develop those symptoms. So that's a big change with that. And then a lot of people ask us about, well, now that I've had the vaccination, do I need to still do all these precautions? And really, the pandemic isn't over. And the way that you combat a pandemic is you have precautions like wearing masks, social distancing, you have those, and you have a vaccine. So combining those together is really the only way that we're going to get ahead of this and get our herd immunity. So you still need to move forward with that. And so I've heard a lot of comments about, well, why would I get the shot if I still have to wear a mask? And I understand that we're all done. We're all tired of this, and we're all tired of wearing masks. Believe me, I'm with you on that. But the reality is COVID itself is so much more dangerous. And to risk getting that because you don't want to wear a mask associated with the vaccine just isn't something that's recommended at all. So the idea is after you get the vaccine, continue to wear the mask, continue to follow those protocol until we hear our numbers aren't plateauing and they continue to drop down. So as far as how long the immunity lasts.
Got it.
Yes.
I thought you were finished. Sorry, go ahead.
Oh, no, I think as far as how long the immunity lasts, a lot of their studies, they're still studying that. Pfizer is talking about 6 months or greater at this early stage of that. And we're going to still kind of watch that and move forward. And really, the way we defeat this as a society and as a world and a nation is that we wearing the mask, following protocol, and moving forward with the vaccine. Dr. Roa.
Thank you. If I could add to that, Scott, if I could just add to that, one of the things I've seen, and actually we talked about it at one of our vaccination sites recently, vaccine or no vaccine, hospital emergency rooms are safe places to go, whatever hospital you go to. We've seen a lot of folks over the last year who should have come to the hospital for stroke symptoms or heart attack symptoms, avoiding the hospital, or the family trying to avoid the hospital because they were worried about getting COVID. I can assure you, going in and out of 2 hospitals every day, I've during the whole pandemic, I felt safer going into the hospital than I did going anywhere else in the community. So we want to encourage people that all hospitals are taking the right precautions to protect the patients and the visitors. But if you have those symptoms that you need an emergency visit, don't hesitate. Get to the emergency room, call 911. don't delay if there's something serious going on. Sorry, I just had to add that little
Oh,
message.
that's great. We saw that as well in responding to calls with our paramedics. Is people would ask, that they didn't want to go to the hospital and they were worried about getting in the back of the ambulance. They didn't want to feeling they would contract COVID. We were decontaminating the ambulance after every patient that was transported. Went through high levels of decontamination to make sure that we would have a safe environment for our patients to transport to the hospital. But we saw a lot of the same things that you did, where people didn't want to respond, and it makes, if you have a stroke symptoms or heart attack, I mean, obviously that can make it so much more worse, including death. And it's important that if you're experiencing those symptoms, that you still go to the emergency room. It is safe to do that, or call 911 and let us transport you there. That's a great point.
All right. Thank you for that elegant and insightful conversation and information piece on vaccines and where we are. We're moving on to our next section a little bit. And we're going to talk about our mobile vaccination programs provided by Huntington Beach Hospital, which are more of our pop-up sites. And Rick's going to speak about these sites, which are one of the many ways that we can obtain a vaccine. Their intended purpose is something that the city of Huntington Beach has really stepped up, which brings our vaccines to our underserved communities, mainly our seniors and our people of color who are seniors who are experiencing various barriers, including transportation, language, and technology, to make appointments and getting to these sites. I think when we opened this up, we originally started with the Athena app and then said, let's get a lot of our senior folk to use high technology to schedule these. And so these programs, I think, have been fantastic at closing that gap for the folks that weren't able to get through the Athena and have been able to be served by that. So Rick, if you want to speak a bit about what we've been able to do with these pop-ups.
Oh yes, gladly. This has been one of the most heartwarming and remarkable things during this whole pandemic was partnering up with the city and Huntington Beach Fire Department to get these vaccines out. We ended up with some surplus vaccines for people who just didn't want to get it at the time, and wanted to make sure we used them up in the city. And so partnership with the city and the fire department, we've conducted, probably given out over 1,700 doses at Huntington Beach Hospital in our tents. We've had tremendous support from not only the fire department, some of our local nursing schools sent students to help with the vaccinations and working with the citizens. Had multiple comments from the residents of Huntington Beach that were able to easily schedule online through the city's program. That it was so much nicer to come to the hospital or something local, not wait too long, and not have to wait hours in a big pod, which at the time was there. And it just got people familiar with the hospital again. And the collaboration between the city and the Huntington Beach Fire Department and Huntington Beach Hospital was amazing. We're in an at-risk neighborhood over in Oakview, and we're able to get almost 1,000 seniors in that area taken care of between various partners. It was a truly remarkable achievement. We've signed up with the state program, the Department of Public Health, to be on the My Turn, as well as staying with Athena. So Huntington Beach Hospital will continue providing vaccinations to the citizens who are getting signed up, and as they meet the criteria. As Jeff Lopez, Battalion Chief Jeff Lopez, told me one day, he said, Rick, as long as you guys have the vaccines, we'll be here to help give them. So City of Huntington Beach, the residents should be pleased to how well their city is working together with local partners to take care of these urgent needs.
Yeah,
That's fantastic. I believe we have a video of Mayor Carr at one of these pods that I think we can roll.
This is an amazing day, and what a great partnership between Huntington Beach Hospital and the City of Huntington Beach and our fire department, community services. This really was a whole collaborative effort to serve our underserved 65-year-olds and our communities that really maybe lack the mobility, that lack maybe transportation, that lack the technology, maybe there was a language barrier, or maybe there was some hesitancy. So this to me is a great opportunity to really serve that underserved community.
I think the collaboration between the city, which mainly is the senior center in the park, part of the city, and the collaboration with the hospital. There's also the Huntington Beach Council on Aging, which Huntington Hospital is a part of, and the Council on Aging is a part of the senior center. So all three have collaborated together to be able to put this vaccination on for the senior citizens of Huntington Beach.
This community is unique. A lot of seniors, a lot of people very independent, but a lot of community, a sense of community here. And that really was evidenced when the idea came up. There was a phone call to the city manager on a Friday afternoon saying, hey, I've got some vaccines we might be able to use. From there, in 3 days, there was a meeting with Battalion Chief Lopez, Chief Haberly, and literally the community relations people got on the phone over Super Bowl weekend and called something like 4,000 seniors. And so we had 600 coming and we had 900 on a waiting list. So the city has been immense help in getting this pulled together. We couldn't have done it on our own.
I definitely feel like with the vaccine, we've seen the numbers drop significantly in Orange County throughout the country. I think we still need to remain cautious, keep wearing our masks, keep following the protocols, but it's definitely improved. I mean, skilled nursing facilities, I've seen an 82% drop in infections since the vaccine came out, which is just so critical because that has been such a devastating disease for that population. And so that's just one example of how we're seeing such positive outcomes after this vaccination.
Go to a nice restaurant and have an inside meal would be great, and then play golf.
Fantastic. That's a wonderful video reel, and I think we should definitely keep showing some of that to our residents of what we've been doing locally. And I think Chief Haverly can speak a little bit about what we've actually done locally here from a city standpoint for our first responders and healthcare workers, and where I was actually able to get vaccinated by volunteering to help out move people through that system. So if you want to speak a little bit about that, Chief.
Sure. So one of the things I think we're really proud of the group putting together, and this was really a one HB moment between a lot of the divisions in not only the fire department, but in the city, with Public Works, PD, our community and library services, kind of working together in the very beginning. Shortly before Christmas, as the vaccine started to roll out, they went to first responders and hospital workers. And so what the county asked us to do and asked the fire service to do in Orange County was to help kind of bridge the gap between the setup of the super pods and the vaccine rollout. And so there were three pods that were set up through the fire agencies. One was in Anaheim, one in Irvine, and then one in Huntington Beach. We would call Central Net, and it's over on Gothard. And so we set up a system where we could vaccinate first responders and medical personnel, and then that quickly morphed into 65 and older. And so the goal for us was to try to get shots in arms as efficiently as possible until the county could set up their super pods. And so we did that for the first couple of months, and we served over 11,000 people were able to receive shots at those facilities. And the staff that was working there from the fire service were firefighter paramedics, lifeguards. They were giving shots and working the booths. The administrative staff and fire, police, and other city facilities. And I think we also worked with, at our Central Net pod, was Newport, Fountain Valley, Costa Mesa, and Laguna worked together with us, and that was our pod that we handled. To this now, that has transitioned to the fairgrounds, where the same fire agencies are working together to manage that location, where that is currently open. But I think we're really proud of the fact that we're all able to come together very quickly and vaccinate well over 11,000 people, the majority of them seniors in our vulnerable population, very early in this process.
Well, that leads, I think, is an excellent segue into how does everyone else get vaccinated? We've got some great opportunities here, and the city has done a great job. We stood up a website that's hbready.com/vaccine. I've used it to help other folks get vaccinated, and because the federal and state government have been distributing their own supply of vaccines to various other facilities, in addition to the county getting vaccines, each site has its own sign-up system. So unfortunately, because everything was stood up so quickly, everyone kind of started out on their own. And as you can see from this graphic on the screen, there's multiple places through multiple agencies and companies that you can get vaccinated. You have to be your own healthcare advocate. I recommend it take some time. Start with the Othina app, get that on your phone, logged in, get to the My Turn website. When you go to the city's website here, each one of these is an actual link you can click on, and get signed up for all of them. And don't cancel your appointment until you have a jab in your arm. I've talked to some seniors that thought that they had appointments ready to go, got on site, and they canceled their other appointments, and then found out they were ineligible at the time, or they'd crossed county lines. So definitely sign up with all these. I've heard that Walgreens is good at about 4:30 in the morning, is when they release their appointments, and Othina seems to update regularly through the day. If you're still kind of stuck in the Othina app in the waiting room, the suggestion that I've seen is to resubmit the survey from the little hamburger icon in the upper left-hand corner, and that can sometimes clear that out and get you eligible for an appointment. So it's a great website, but definitely you need to be your own healthcare advocate on this and sign up for everything until you get vaccinated. And I think we've got one of the questions later about mixing and matching vaccines, which you cannot do, and to make sure that you follow that. So I think Rick can speak a little bit about the state website here.
Yeah, thanks, Dan. It's www.myturn.ca.gov. It's a newer website. Athena's been up in operation for quite a lot more time. It's getting sites added daily, so to your point earlier, make sure you're the advocate for your own healthcare. Keep pursuing whatever site you can. We're registered with Othina, we're registered with the county, and we're registered at the hospital with the My Turn through Blue Shield, which is a third-party administrator. We expect that to get function more smoothly as each day goes by, much like Othina did in the beginning. But there's a lot of resources out there. Just don't give up. It'll get smoother and smoother, and we'll get these vaccines out. And we're going to, like I said earlier, we're going to continue. We've already registered for twice a week until we get everybody in California vaccinated that wants a vaccine. Thank you.
And thank you so much. And that's the goal, right? Is to get everyone that wants a vaccine vaccinated, and to have those conversations with our family members that maybe you don't get to see your grandkids until you get vaccinated. And try to drag your parents and those that are hesitant along, that this is safe and effective, and it's the one way we can get our businesses back open and get everybody back on track. So we got a lot of data, and it's a lot of very smart people working on this that are working for the common good, that have worked their whole lives to shine in this moment, and they have. So I want to open it up now to some questions and answers. We have a couple of pieces here that some folks emailed in. I'll try to decode a little bit of it as well. So someone asked, is this true? Recommendations for the J&J are reported to be just for 16-year-olds and not for adults due to blood clotting issues. And I'm guessing that that's a confluence of some misinformation there. So Dr. Rick, I'd ask you to answer that.
No, I've not heard that at all.
That's pretty easy. And I think
some misinformation.
Yeah, I think the blood clotting thing is maybe coming from the AstraZeneca vaccine, which isn't isn't available in the United States.
Right. They were coming up with side effects, and a lot of the problems that are out in the community are, I'd just say, the news media, social media websites jumping on one adverse event, which we'd expect from any drug, any vaccine to have those. So often, if you hear that, check with somebody who's reliable, your own physician, your local pharmacist, fire department, anybody can be able to give those answers, because we don't want people avoiding getting a vaccine because of misinformation.
That's a very important answer, right? Is talk to somebody who has a medical background or a medical degree about your medical care, and not somebody in the front seat of their car doing a YouTube video who has no background in this. So we want to make sure everybody's getting good information. The next questions I think we may have covered, but just to put a finer point on it, is if you are vaccinated, can you give the virus to anyone?
If you're vaccinated, can you give the virus? No, if you're assuming the question is saying, I just got my vaccination, can I give the virus to someone? Not from the vaccine. The vaccine does not give you the virus. There are those times in between the two vaccines. Again, we're not fully protected until the second dose of the Pfizer and the Moderna, about 7 days after the second dose. There could be those rare cases of coming across COVID and in between and passing it on, but it's got to be pretty rare. Even a single dose is very effective. You just don't get the full effect until the second dose.
And to I think clarify a bit more, I think they may be asking that if you've been vaccinated, can you still get COVID and give it to other people? It sounds like there's a small chance, but
yeah, I got to say it's an extremely small chance. At 94-95% protection, that's unheard of in any other vaccine that we've seen. I have not come across anybody who's been vaccinated and got COVID, but I imagine out of the 7 billion people in the world or so, you're going to have a case or two of that. But
right, and I think that goes back to what you were speaking about with misinformation and some of the news grabbing onto things where they'll say, eight people got something, and you look at it out of 1.2 million or something, right? You got to get the full context, and I think some of the headlines are misinforming folks.
Dan, and more information is coming out. We knew 5 months ago. There's a lot of different information we know today. And as we go on and these studies progress and we follow people in the studies and patients that are getting it, we're going to learn more and more. And again, go to reliable sources for the latest information.
Right. I 100% agree. That's fantastic information for, I think, just all of life. Just go to reliable sources to get information. Someone asked that I don't know if they're a scientist or not, but they said they'd like to see evidence of kids transmitting COVID. I've seen doctors saying kids carry a quarter of the viral load as adults, and since they don't get very sick or symptomatic, they don't transmit it as much. That seems like a lot of anecdotal, again, like a bit of misinformation here and there putting together, but maybe let's talk about, what is the data that you have on children transmitting the disease. I saw a recent study showing that COVID is living in the gut of children for a while, but it sounds like we still don't know a lot about child transmission, or do we?
Unless Scott has an answer for that. Not much more than what you just said. We're learning more. Children can transmit it even asymptomatically. And so until we know for sure, that's another one of those things, we take the extra precautions. I have not seen the studies come out of CDC or any of the major journals delineating the age group on that.
Okay, and that's where we got to get our source. All right, so a couple of other simpler questions is, can I choose which vaccine I can get?
No.
Good answer.
It's a good question though, because people have, for some reasons, what they read, what they would like to get or what they think they would like to get, or one is better than the other, or they're people that are saying, well, if Moderna and Pfizer are 94% effective and Johnson and Johnson is only 64 or 67, it's not as good. That's totally looking at the data incorrectly. Those vaccines, the first two were tested in total different populations than Johnson and Johnson. Johnson and Johnson was tested really at the height of our second surge, and was exposed to more variants and was tested in more countries. All three of them prevent serious illness and death. And so those are all pretty good choices. So when somebody says, well, I don't want that one, sometimes I don't have a choice. The county last week said, I'll send you some Moderna. I'll take it. So the advice is what I think Scott mentioned earlier, is if you're offered a vaccine, take the vaccine.
Yeah, and also you can't if you get a Pfizer as your first shot, you can't mix it with anything else moving forward. So we've had people ask before that, well, I have an availability to get a different Moderna or Pfizer, but if you start with Pfizer, and your second one needs to be Pfizer and Moderna, and so you don't want to get a Johnson & Johnson as your second shot for Pfizer. So it's important you get the same vaccine for both shots.
Correct.
Yeah, and then what about the flu vaccine? So obviously because of all of our COVID precautions, the flu seems to have been almost non-existent this year. But going forward, how does the COVID vaccine interact with the flu vaccine, and should we still get the flu vaccine even if we've gotten the COVID vaccine?
I haven't, Scott, I don't know if you have a thought on that, but I haven't seen studies coming out on that yet. I do know that I think it's Moderna, is developing already a COVID flu vaccine. Flu vaccines normally in a year, they're predicting what's going to come up next year and then create the vaccine from that prediction. And this year it was almost non-existent in all of our emergency rooms. We knew about that ahead of time because the Southern Hemisphere, which goes to the winter first, there weren't any cases or that many cases of flu. So I know the companies are rapidly trying to use some of the newer technology to try to put a vaccine together that would do both. If they don't, do you still take both? Yeah, if you're taking a flu vaccine this year, take one next year. And the COVID, I think they're working on booster shots and different scenarios as they watch how long these are really effective in preventing the disease. And that just takes time.
And then I believe in one of your slides you said, and you want to make sure you've got a 14-day window after you get your COVID vaccine. You don't want to get a flu shot in that window, right?
Correct.
Okay. Which leads into the next question. Are vaccinated people keeping their immunity, and are we going to expect that COVID could become endemic, and in which case we'd have to get a COVID shot every year in addition to a flu shot? Where's the needle pointing on that at this point?
I think the needle's pointing to, since they're developing the booster shots, they could be just in case, but I think it's pointing to we may need vaccinations yearly with the same thing. But again, that is something we can't speed up. That is time, and testing people over time to see how long their antibodies. Certainly Moderna's gone past 6 months. They released a study saying that. But they're at the same time developing a booster just in case.
Okay. And then someone asks, why are so many people getting sick after receiving the Moderna and Pfizer vaccines? You can explain what those symptoms actually are, I guess.
Yeah, the symptoms, I think Scott addressed it earlier. It's sore arm, chills, fever. That's your body's reaction to the vaccine itself. It's not a reaction to getting sick. So those are just normal post-vaccine. If you've got a flu shot and you touch your arm the next day, or you get a tetanus shot, your arm is sore for a day or two. That's just your body's local reaction going after that foreign body or substance and creating antibodies to it. So as much as it might be sore or have a headache or a little temperature, it's almost like good. I know it's working. My body's working.
That's really great. I think a lot of folks, other than the flu vaccine, right, we're I think a little too young to remember their last big vaccination rounds, right? When I have a 2-year-old and she's just getting ready to get her second set of vaccinations, and so I think we don't really remember what it's like. And someone asks, can you get the vaccine if you're currently sick with COVID?
The recommendation is to wait.
Okay.
Until you've cleared the symptoms, the typical quarantine period.
All right.
And you can wait actually up to 90 days if you feel better about that too, but certainly not to get it while you have COVID is recommended.
Okay. And I think we had a video question. Is that still available?
When is this craziness going to end? That would be my question. When is logic going to return?
Well, so yeah, I think we're all feeling the craziness, right? I think we're all over COVID, over wearing masks. I think we'd all like to get back to what normal looks like, and for us. So, but I think we have control over that. If we, the more people get vaccinated, the more we wear masks, the more we're following the protocol, and really trying to look out for one another and keep encouraging one another to do that. I think then that's the faster this will get through this. And so it looks like we have a June 15th timeline that's promising for California, and that will happen if enough people get the shots and if the hospitalizations stay down. Then we can start what that looks like, and that could be as soon as June. But it's going to require us to do our part together.
Of course. I think we have one more video question.
I myself am dealing with having long COVID or COVID long haulers. I have 2 questions. I'm wondering if first, do I get the vaccine if I still have antibodies? And the second question is, since I'm already still dealing with long COVID issues, is the vaccine going to make those worse? Or is it something that's going to help with the long COVID issues?
Discuss that question with your doc, because especially with the complications of the lung, post-COVID lung issues, I think it takes a little more, somebody's familiar with you and your history and your medical history to give that advice.
And I guess the follow-up for that would be, are primary care physicians getting access to the vaccine at this point? Or would it be a consult and then go make an appointment?
There are some large clinics that I've heard are getting the vaccine, but most physician offices are not at this time. It's the Walgreens, it's the partnerships with the larger institutions at this time.
Okay, great. And so I guess there was a follow-up to, I guess the question about those getting sick. I think the question was more over like, why is Pfizer and Moderna having, I think, more robust side effects than the J&J vaccine? Just the mechanism of the way the vaccine was designed?
I haven't seen any studies on determining which one or why one is more reactive than the other. It could be the mRNA technology is a little more robust. But again, I don't know that fact for sure. That's one of those things. It's like, who knows? You don't get a second dose with J&J, so you don't have your body already creating those antibodies, and therefore you're going to get, you don't have that extra boost of response that you would get with the second dose, since you're only getting one, and that might have something to do with it.
Right, and one more question I think that we've got from the folks here, and I think we covered this on a slide, but maybe we can recap a bit, is that who should not get the vaccine?
So again, people with allergies to the additives in it, the polysorbate, the PEG, the polyethylene, people who are within 14 days of another vaccine, And that's primarily, there was one, it's the third one is on the slide.
Yeah, the antibody.
Yeah, if you've gotten antibody treatment.
Right. If you had the convalescent plasma or the monoclonal antibody treatment, which some people had, less now, then you'd want to wait 90 days before you get the vaccine. And that way it has a better chance of eliciting the response at your need.
And I think, as always, right, that consult your primary healthcare physician if you have questions on that.
Correct.
Okay. I think there's one more question inbound here, and I think we will be wrapping up. I will give it one more second here to see if that's coming in. And well, I don't see anything else coming in, so I'll go ahead and oh wait, here we go. So I think this is a little all right, we'll just go with this question. Why are we letting ourselves be experimented on by gene mutation therapy?
Well, that's a good one. Actually, I think that question probably stems from perhaps misinformation. I don't know where the person's coming from on that. I certainly was one of those people that had concerns. My background is pharmacy, and I had concerns with the vaccines and how they were developed. And I just kept watching and watching until all of a sudden I had to order the vaccines for the hospital. I started getting busy a month before, 2 months before, doing some research. I felt very, very good about the technology of the mRNA and how it's used, how it doesn't affect your genome. It's basically printing out a recipe to make a protein or to make, just like you would at home. You print out a recipe off the computer, you slip it into or maybe the CAD drawings, you slip it in, it makes the product. It's and your body destroys it right away. It doesn't get into your DNA, so it doesn't really affect your genome. mRNA is a very tiny particle and very fragile, so it doesn't last very long in your cells. Your cells clean it up constantly, going that. So.
And I think, Doctor, you brought up, you said something there that we've got just one more minute, and I hope you can answer this. Is that you said you did your research, right? And would you describe like what your research was when you did this?
Well, I take not only the government sites, but legitimate medical researchers, Harvard, USC, the big universities, and not taking any one of those at face value. You take what this expert says and you combine it with what another expert says, doing legitimate studies, not the speculation, not the conspiracy theory type studies, but actually drug studies, medical studies, and seeing what makes sense out of that. I didn't use, I don't care what news outlet you watch, I didn't pay attention to them at all. They're not my medical research experts, even though sometimes they're correct in what they're reciting. I just had to have the hands-on, but those are and those sources are available on the internet too. It's just not social media. You can go to those sites and look at the published studies. We reference the American Journal of Obstetrics and Gynecology. These are peer-reviewed journals where multiple scientists look and review the data. That's how I did mine.
I appreciate that. I think a lot of the folks talk about, I did my research, and we don't really discuss what that research was or the sources that were used and understanding what those sources are. So I appreciate taking the time to explain that. Well, with that, I'd like to thank Dr. Rick Rowe and Chief Scott Haberle tonight for taking time out of their busy schedules to talk with us about COVID. You can get more information at hbhospital.org, and COVID resources are available at hbready.com and hbready.com/vaccine. A recording of tonight's training and video will be available at hbready.com/town hall. I'm Council Member Dan Kalmick, and I'd like to thank you all for taking time out of your day to watch this and participate. So thank you very much.